So we talked about obstructive sleep apnea introduction type of information last time. I thought I will go further and talk about it a little bit more. The question would be who should get the sleep test done to find out if indeed they have sleep apnea or not. There are certain signs and symptoms which I have briefly mentioned in the past one, which includes, of course, the obesity or increased BMI, small throat, snoring, and witness apneas. So certainly all these things are there, but in addition to that, let me mention a few more which are rather important. For example, irregular heartbeats called atrial fibrillation. Almost one third of the people who have atrial fibrillation and which is uncontrolled, which means their heart rate continues to go up and down, and they need medication adjustment, have sleep apnea, especially if they're obese or at least overweight. So one third of the patient with atrial fibrillation, which is substantial number. So anybody who has atrial fibrillation, is extra weight and has some trouble controlling the heart rate should consider getting a sleep study. Number two is that people who have uncontrolled blood pressure or uncontrolled diabetes, that means in spite of adequate diet and adequate medication, if somebody is finding that their blood sugar fluctuates substantially, they should consider a sleep study, especially if they have associated other findings, which include elevated BMI, body mass index, or big neck, small throat, snoring, etc. The reason is because the catecholamines, which are secreted during the phase of apnea, increase the blood sugar and increase the blood pressure and increase the heart rate. So all the three things that so far I mentioned, the atrial fibrillation, uncontrolled diabetes, uncontrolled hypertension, all these things are associated with sleep apnea. Then if you have non-specific complaints like fatigue, unsatisfactory sleep, disturbed sleep, waking up choking, all these things, or daytime naps, these are all pointing towards it. So the medical community has come out with a score. This particular score is called Epworth, Epworth, Epworth Sleepiness Score. So there are 6 questions in that particular score, and one has to give an history about the sleepiness. And these are simple, like do you fall asleep while talking to someone? Those are unusual, but still there. Do you fall asleep when reading a book? Do you fall asleep watching a TV? Do you fall asleep while driving? And do you fall asleep while driving as a passenger in a car for 1 hour or so? And these are basically the ideas. So the average Epworth scores, normal people do take sometimes afternoon nap. Normal people sometimes fall asleep while watching TV or reading a book, especially both of these are boring. And a lot of people would fall asleep while they are a passenger driving for 1 hour, not they themselves. But most of the people don't fall asleep while stopping at a traffic light or driving themselves or talking to someone. So they have a mild, moderate, severe type of situation there, and you can score it. And usually the scores less than 10, maybe less than 9 or so are average. Once you start getting over 10, that indicates that you are excessively sleepy, or also called hypersomnia, or also called EDS, excessive daytime sleepiness. So if you have that means if you have a high Epworth score, if you have excessive daytime sleepiness as suggested by Epworth score, in addition to that, fatigue, disturbed sleep, witness apneas, loud snoring, obesity or overweight, big neck, small throat, atrial fibrillation, hypertension, diabetes, which are uncontrolled, these are all things which will point to a sleep apnea. Untreated sleep apnea is risky. Please remember that the apnea, which means you stop breathing, or hypopnea, which is decrease in depth of the breath by 30% associated with 4% drop in oxygen, leads to a low oxygen in the blood. Now remember that this blood is circulating to the brain, circulating to the heart, circulating to the liver, circulating to the kidney. What will happen if your brain is deprived of oxygen for X number of minutes? What happens if your heart doesn't get enough oxygen? You can imagine. So these are risky things. There is an increased incidence of strokes in untreated sleep apnea, increased incidence of worsening of congestive heart failure, increased incidence of diabetes, high blood pressure, etc. is always seen with untreated sleep apnea. So one has to be associating these diseases, and if they are not well controlled, then one must consider sleep study. We sometimes do a nighttime oxygen check. The pulse oximeter, as they are called, we check your oxygen through the finger, are very cheap, but they do not record. They just tell you what it is at that instant. In fact, some of the Samsung phones I have seen have an app that can check your oxygen saturation. So I'm not talking about checking spontaneously when you're awake, but a oxygen which is continuously monitored, recorded with a finger probe during the sleep time is a very common practice. It's a cheap test. I don't think it costs even $20, and it is covered by the insurances. If that shows that an oxygen is dropping to a critical level, and critical level determined by insurance companies, medical authorities, and Medicare, more importantly, Medicare and the health insurances, is 88%. That 88% will probably correspond to the actual blood measurement of oxygen, what is called partial pressure of oxygen, less than 55. Normal pressure of the oxygen in normal person is 85, 90. When it drops to 55, the saturation drops only to 88. And that 88%, if it is there for more than 5 minutes during the entire night, think about it. Let's say 8 hours of sleep or 7 hours of sleep. So almost 400 plus minutes of sleep. If you drop your oxygen to less than 88% for a total of 5 minutes, so one time it was 5 seconds, another time it was 10 seconds, third time it was 30 seconds or more, total, if you have for 5 minutes or more, then you do need oxygen with sleep, or you do need sleep study if you do not have any lung condition that could explain the drop in oxygen. People with emphysema, COPD, pulmonary fibrosis, etc. will have low oxygen levels during sleep because the breathing is shallow. So the transfer of oxygen with a lesser volume is hampered. But in normal people, we do not drop oxygen below 88%, especially for more than 5 minutes. So if someone has dropped their oxygen for more than 5 minutes during sleep, and there is no obvious reason, emphysema, COPD, fibrosis, then they need to be on oxygen, and or they need to have a sleep study done, because the treatment for sleep apnea is not use of oxygen. Insurance companies, Medicare, and medical people feel that using oxygen when you are actually dropping your oxygen due to stoppage of the breathing is not a right treatment. And in fact, they will refuse to pay for it. So if you do have drop in oxygen with nocturnal or nighttime oxygen check, you should consider sleep study. So in last minute or so that is remaining for my talk, I will summarize certain things. Obstructive sleep apnea is commonly seen in people who are obese, overweight. However, it is also seen in normal weight people. It is more common with neck size which are larger, small throat, associated fatigue, disturbed sleep, snoring, waking up with choking, daytime excessive sleepiness or Epworth score of greater than 10, 11, and associated uncontrolled hypertension, uncontrolled diabetes, uncontrolled congestive heart failure or recurrent episodes of congestive heart failure, and more importantly, atrial fibrillation. So if any one of you guys or anybody who has it, they need to do a sleep study or nocturnal sleep study, nocturnal oxygen check, and then consider sleep study. I hope this explains and helps you. Thank you for watching. If you like it, please subscribe. Have a nice day.